Hi LA Weekly Asia， 大家好，我是 Christine Chiu， 然后这个是我的先生 Dr. Gabriel Chiu。我们今天在 Beverly Hills, California， 这是我们的 office, Beverly Hills Plastic Surgery. And today we're going to unpack the most popular and secretive procedures performed here in California. Oh my goodness.
What did you look like before I met you?
Well, it's actually really interesting. A lot of people think because I'm married to a plastic surgeon, I've had a lot of work done. And I'm sorry to say I haven't had any plastic surgery on my face at all. I've had Botox, I've had fillers, just in my lips. He doesn't let me do a lot. So I don't know if it's a good thing or a bad thing.
I don't know if it's I don't let her do a lot or I can't tolerate doing a lot because she is really, really scared of needles. So I have to go to extremes with medicating her in order for her to tolerate it. True fact, I've done more things than she has.
Well, you're older, no offense. I mean, if you can't tell.
But I also like to try all the different things to see how well they work before we actually use them.
So what did you look like before I met you?
Probably same, but older. I think the most popular, well, there's a couple of them, but I think really the big one right now is weight loss, Ozempic. Whether you're using Ozempic, Wegovy, Zepbound, Mounjaro, that's the most popular thing. And it's, why do I say that it's a cosmetic procedure? Because these patients who are doing it, especially here in Beverly Hills, are not doing it because they're obese. They're doing it because they want to lose a couple pounds. Daxxify is a longer lasting neuromodulator compared to Botox and Dysport. It lasts up to 6 months. And
there's Skin Vive, which just got approved in the US. It's been used in Europe, but it gives you that hydrated glow, that dewy skin that a lot of Asians like. Or contouring the stomach and the belly, because fashion and beauty go hand in hand together. And a lot of times what we see in fashion translates to the procedures they do in cosmetic enhancements. So when we're seeing a lot of crop tops or low hanging skirts or pants, then we're seeing a lot of abdominal etching, whether surgical or non-surgical. Yeah, I like Emsculpt, and I strap myself on Emsculpt every weekend that I can. I come in and Baby G reads a book or plays with his Legos, and I'm getting my abs sculpted.
For a patient in their 20s, taking care of their face, I would say, do things like Formafacial. It kind of tightens up the skin and the tissues, looks really nice and gives you a bit more glow as well because it is tightening up the skin and shrinking your pores. In the 30s, I would say that in your 30s, you should actually start thinking about anti-aging if you already haven't.
In my 30s, it was a shock to me because in my 20s, I had it easy and I just coasted. And then in my 30s, I would look in the mirror and start seeing things that I did not expect. I think a lot of my friends in their 40s are doing Morpheus here. Maybe mini lifts.
In the right patient, that's what the radiofrequency and microneedling is doing. It's going ahead and providing that mini lift that you're looking for or tightening up the skin. I would say that some of the craziest patients are actually medical personnel, like plastic surgeons. I won't say his name, but he's a brilliant plastic surgeon, Korean, in Florida.
Okay, don't give any more clues.
There's a lot of Asians in Florida. I'm not narrowing it down any more than that. But
his office is on 526.
No, he really is brilliant. But he went ahead and did his own eyelid surgery, Asian eyelid surgery. When he told me about this, or someone told me about this, I said, "Really? How did you do it?" And he says, "One eye at a time."
My crazy story is more heartfelt. It's a story about how breast implants save someone's life. There was a patient, a husband and wife, and the husband actually did not want the wife to get breast implants, and she really, really wanted to do it, and they were arguing in the office, and it was very awkward for everyone, but she ended up doing it. And then they got into a car accident, and it was head-on car collision. And what we found out afterwards, when they were in the hospital, was that the pair of implants actually saved her lungs from collapsing. The moral of the story is Get yourself a pair of implants. They're like built-in airbags, but anyway.
Do your research beforehand. It's very easy to do that because of the internet nowadays, but also make sure that you go to sites that are very reputable. Don't just go to like Reddit or something else. Or
No, Reddit, I love Reddit.
Sorry Reddit, I have nothing against you.
Oh my gosh.
Okay,
do you know how many people come to you because of Reddit?
I know. No, the thing is that what I'm talking about is to get your information, you want to go to medical resources. And when you go see them, see if you click, because this is going to be someone that you're going to deal with for at least 3 to 6 months to make sure that things are going well.
What I would tell my friends who are looking for plastic surgeons or any cosmetic work done, definitely don't get lured in by like a fun TikTok doctor. And the more a doctor and a surgeon operate, the more things they will have encountered, the more complications they would have encountered, and
so
learn
they know
how
to take care of them.
So you need, that's what experience is, and also lifestyle. Just make sure that you're considering that you have the safest doctor who's going to bed like at 10 p.m. So he's fresh and experienced for your surgery.
再见 LA Weekly， 下次再来。
Bye bye.